Ladies and gentlemen, welcome to Chat Room with Max. Today is going to be an interesting show. You're going to learn a lot. So if you have your pen and your paper, make sure you have it handy so that you can jot down some things. Because what you're going to be learning today would teach you a lot about some things you might have noticed in your children or your neighbor's children or your siblings' children or someone else's child. So have your papers and your pen ready. We're going to do a lot today, okay? We're going to be talking about two things. We're going to be talking about autism amongst children, and how to care for a child with autism. Autism amongst children, how to care for a child with autism. And we know what today is in the United States. Today's Mother's Day. We're also going to be talking about that too. So with me here to do justice is a very, very world famous doctor. If you see this guy, he's very popular on TikTok and everywhere. You guys will learn a lot from him. But before I bring him up, let's just throw this intro and then we will introduce you to the person sitting right beside me.
What's popping, beautiful and handsome people? You already know it's your girl, Pretty Yanni, and I'm the host for Hot Set with Pretty Yanni. You're now tuned in and listening to Chat Room with Max. Enjoy.
Pretty Yanni, everybody.
Oh.
Yeah, she's back. She's back on the show. Pretty Yanni, the CEO, owner of Hot Sit with Pretty Yanni, a very, very nice, popular YouTube show. She does a show on YouTube where she interviews a lot of these popular comedians, creators, musicians, all of them. She's right there. I think you did this Mommy Wa. The other time you did Nas Boy before he released the single. You did, yeah. Oh,
Yemi Craig's.
Yemi Craig. Oh, she's talking as if she's not doing interviews to them. Don't worry. You guys will see what she's up to today. So, ladies and gentlemen, without further ado, let's welcome the one and only Dr. Lewis, everybody. Welcome to the show, sir. Welcome to the show.
What's up?
Yes. Welcome to Chat Room. I know this is your first time on Chat Room.
Yes.
We're glad to have you here. It's actually, in fact, I had to pay a lot of tickets. I had to email a lot of people to get to this great doctor. You know, he's very, very humble and nice. If I DM'd him and he was like, "Yeah, of course, let's do this." So he's going to introduce himself right now and give us his credentials, and let's get to know him. Okay, Chatroom family. All right, sir. Please, can you introduce yourself to us, sir?
Sure. So my name is Luis Apiakubi. So Dr. Luis, for the most part, is what everybody calls me because that's easier. The Apiakubi is a bit too complicated for folks. I am a licensed clinical psychologist here in Columbus, Ohio, in the United States. I am originally from Ghana, in case you couldn't tell.
Woo woo!
Right, and I specialize in psychological assessment of autism, ADHD, and other mental health concerns. That's my jam. That's my main area. I did my bachelor's in Ghana before I moved here to do my graduate studies, and I got my doctorate here in the United States, in Dayton, Ohio. So that's a little bit about me. And today I'm hoping that we can continue to spread the word about autism in communities like mine, in communities like ours, so that more people will be aware of how to spot the symptoms and seek early diagnosis, because early intervention is so important. And also how best to, some tips to help parents as they navigate the whole process and taking care of their kids. I'm excited to be here.
Thank you very, very much, sir. Thank you very much. Wow. We're glad you introduced yourself properly. Well, let me add something that we did not add before. We were from Nigeria. Let's not go to the Jollof part for now. What they will say.
You already know.
Yes. So let's just dive straight in. For those that are watching right now, what is autism? Especially, what is autism in general?
So autism, we call it a neurodevelopmental disorder, right? And I will be using some phrases and I'll try to break it down afterwards, because it is sometimes those phrases are just about the only way to describe them. So autism is a neurodevelopmental disorder, and what that means is that it's something that individuals are for the most part born with. So you, as a child, you live with it. You're born with it. You take it all the way with you through adulthood. So it's a neurodevelopmental disorder that often shows up in the way the person interacts with the world, effectively, like in more ways than one. But the main ways that we look at and think about is through your social interactions. So what you will see is that the person does not do very, very well, at least when it comes to our perceptions of how things should be as neurotypical people or people who don't have autism. That they struggle in social situations, that they tend to be awkward, they tend to be quirky, etc. So typically it's around their social difficulties, and then it tends to be also things like rigid behaviors. They tend to struggle with change, and sometimes there are sensory issues as well. So kind of that's a general idea of autism and how it affects individuals. And the symptoms I mentioned look slightly different depending on the person, depending on their background, depending on what experience they've had already. So we'll talk more, I guess, specifics as we go along, but that's the general idea of what autism is.
Okay, nice, nice. Wow, thank you very much for that. So, Pretty Annie has a question.
Sure.
Yeah, thank you very much for that. So I was just gonna ask you, what do you think are some common signs or symptoms that parents might notice in their child if they, probably like suspect that they happen to have autism?
Mhm. Right. Now, so while I said that it's mostly around the social bit, when you have a 2-year-old or 3-year-old, it may be difficult to see social difficulties, right? So, because for most people, maybe there's a sibling at home and that's about it. So you don't know how they do socially. So some of the earliest signs that parents see are around developmental delays.
Yeah.
Are they talking at the time they're supposed to be talking? Are they walking? Are they potty trained? Are they, relatively independent for their age, doing certain things for themselves? How are they eating? How are they reacting to, like sounds and lights and things that other people react to with no issues at all? When you're talking to them or engaging with them, are they staying with you? Are they looking at you? Or are they struggling with eye contact in the sense that you could be talking to them and they just looking somewhere, it doesn't occur to them naturally to look at you. Now, like I said, all of these things will look different depending on the child's age and what they've been exposed to as they go on.
Yeah.
So I always tell parents, when your child is growing up, your best friend is your child's pediatrician. Look,
Mm.
that's how you will know what is a delay,
Hmm.
right? So if your child is not talking at a certain age, are you going, well, this person's child didn't talk by that age too, so maybe it's normal. Or you ask your pediatrician who will tell you, well, that makes sense given this and this and this and that, so don't worry. Or the pediatrician will say, oh yeah, no, let's talk to a let's talk to a speech therapist, or let's look further into this.
Yeah.
Yeah.
Yeah. Okay. So, in case you're just joining us, welcome again. Welcome to Chat Room with Max. Today we're talking about autism amongst children and how to care for children with, or for a child with autism. Autism amongst children and how to care for a child with autism. So, like we always do here on the show, please and please don't forget to like where you're watching this from. Do not forget to subscribe to this channel. Do not forget to hit the notification tab. And lastly, do not forget to share, okay? Share, share, share. Just keep sharing, all right? Because this is very, very educational. It's something that you might have noticed and missed. It's something that you might not have noticed yet, but after watching this show, you would see some of those things we're talking about, and that will prompt you to seek further help. Okay, so let's get the show going. Lastly, also, don't forget to type where you're watching from. Just say hello, type where you're watching from, type your questions. We will take all questions today for chat room and for Dr. Lewis. Okay, all right. So Pretty Annie has a question to ask.
Oh yeah. This might be two questions, but the first one, right? Um, can autism be diagnosed prior to the child being born or not?
Good question.
So for now, not. We don't have enough research and studies to comprehensively diagnose autism yet, right?
Okay.
So people, I mean, there's so much research still in progress, and there are certain things that sometimes individuals with autism also have, such as things like Fragile X syndrome, Down syndrome, that are farther along when it comes to being able to diagnose it earlier, sometimes even in utero. But autism, not yet. The research hasn't gotten to the part where they can diagnose it when the child has not been born. No, not yet.
Okay. And I know that when you were answering the previous question, you did say that there are ways to tell if the child, has like, autism early. But I mean, coming from an African home, you know how like spiritual parents can get sometimes as well, even though I'm not trying to go into that.
Please feel free, let's go.
Yeah, but is there a possibility that a child could be like misdiagnosed?
So misdiagnosed, that's then they don't have autism and they say they have autism.
Yeah, uh-huh.
Oh, yeah, I mean, so it's a human institution, right? So mistakes are always possible, But if the person that the specialist in case is doing their job well, we only work with the symptoms we're seeing / not seeing, So for example, if at this certain age we're supposed to see a child, speaking this much and they're not speaking, we're supposed to see a child engaging, with respect to socially with other people in a certain way, and that's not what they're doing. We're supposed to see a child who manages sensory or sounds and related things in a decently okay way, but this child is struggling significantly with that. Then as we are hitting the symptoms of autism, then we go, yep, the child does meet criteria for autism. So we only work with what, like the right way to do it is to work with what you're seeing / not seeing it. You're using these symptoms as they've been, laid out for you. So you're going check, 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 So if it's not there, ideally you shouldn't be diagnosing it, right? And if it's there and you diagnose it and it turns out that whether it was due to something else or it turns out later that it was a misdiagnosis, the child didn't in fact have autism. I always tell people there's no downside. Like we live in a community where there's a lot of prejudice, yes, but I would rather, if somebody's going to make a mistake, right, I would rather they make a mistake and diagnose a child with autism when they don't have it than tell a parent that the child doesn't have autism only to find out later that in fact they do.
Okay, so sorry, question for you, sir. My question is this. Don't you think that when a person is being misdiagnosed, because we know how the society we live in is, especially where we're from, we know stigma and all that. So if a person gets misdiagnosed, can that diagnosis be cleared up totally from that person's record?
Absolutely. Right. So you have to, some of it is probably, the system that I live in, having lived in the US and practiced here for a while. But you have to keep in mind that any diagnosis is your private health information. It's for you and your child. Right. I mean, if you're an adult, it's for you. If you're a parent, it's for your child, and by extension, you. So you share it with who you want to share it with. Right. So a parent can have their child diagnosed with autism and never tell anybody else. It's their business. Right. And, to more directly answer your question, if later you find out that, the diagnosis of autism was not accurate, then your child doesn't have autism. Right. It doesn't happen often, but if it does happen, your child doesn't have autism because the person who is assessing them now will write in the report that this child does not meet criteria for autism. And that renders everything that has been done before moot.
Yeah. Okay. Thank you very much. So I don't know if some of you had some whispers at the background. Pretty Annie was asking me a question. And while she was asking me, I was like, we have the doctor in the house for you to ask this. Specialty. So she's going to ask her question now.
Lex, if you don't mind, let me touch briefly on the misdiagnosis. You know how I said,
please.
I would rather have you get it wrong, say the person has autism when they don't, because when you diagnose someone with autism, one, the things that you're going to do to help a child with autism, right, will, to be honest, help almost any child, because you're taught how to better interact with your child and know what their needs are and meet them that way. You're taught to be more patient. You're taught some things to expect from the child. Let the child guide you in certain ways, and then you meet them that way. Such way of thinking, or you're taught ways to, when you see certain behaviors in your child and it's not necessarily harmful and it's just sometimes just annoying as a parent, ways to ignore some of those things and pay more attention to the things that you can help them build on. These things will help any child,
True.
help any parent. Like it's a skill
Development,
set that
yeah.
any parent will benefit from. However, if they tell you your child doesn't have autism, chances are they don't enroll you in any classes to improve your parenting skills, or they don't tell you anything to help to look out for in your child. So if in fact your child has autism later on, now you're stuck because you don't know how to deal with it,
Mm,
right? And because you don't have the skills, you're more likely to do things that are not necessarily helpful.
yeah. True.
So yeah, so in my mind there is very little downside. I get it, the stigma bit is there, right? But then I also cut that off by recognizing that it's your child's private health information. So people don't have to know they were diagnosed with autism for you to then have to go and tell them, oh, by the way, it wasn't correct, if you decide to keep that to yourself.
Okay, thank you very much. So before Pretty Annie asks her question, if you're just joining again, welcome. I hope you are enjoying and learning from this session, because chat room is not all about laughing and joking all the time. We also bring some educational pieces to you so you guys can learn from it, and we also can learn from it. So today in the house we have our wonderful Dr. Lewis, who is here. Thank you very much again, Dr. Lewis, for joining us. So, like we always do, please don't forget to like where you're watching this from. Don't forget to subscribe to this channel. Do not forget to hit the notification tab so you know whenever we're on. And lastly, don't forget to share. Okay. Please say hello and let us know where you're watching from. Write your questions in the comment section to us, and we will answer your questions. Okay. So we have Jesse Chops in the house. She says, good evening, everyone. Jesse Walt watching from Nigeria. Yes, welcome, Jesse Walt. We have Livy's Kitchen in the house. She says, hello, good evening, everyone. This is Livy's Creations watching from Bridgewater. Welcome, Livy's Kid Creations. So while we wait for your questions, Pretty Annie, go ahead, ask your question, please.
Yeah. Well, there's no stupid question, right?
Nothing like a stupid.
Feel free.
Right. So how, let's say somebody did like let's say, damn, how can I fine, let me just ask the question.
Just ask it.
I'm trying to justify my question.
No need to justify.
But okay, is there a difference between autism and mental disorder?
If you think about like mental health disorders, it's a wide range of.
That's why I wanted to like give you like a scenario. So, okay, you know how like you said autism, like loud noises, all this stuff, like speech, yeah. And let's say like someone, let's say, you got into trouble and then you have autism. You know what I mean? And then they want to make it seem like it's mental disorder. I don't know. Hopefully you get what I'm trying to say.
Yeah, so autism is a mental health condition, I guess, if that's
okay.
So when you look at I think one of the books back there, the DSM in America, the diagnostics, the DSM is a book that we use to help us with diagnosis. There are several mental health concerns: depression, anxiety, ADHD, OCD, PTSD. Autism is in that book.
Gotcha.
Right. So it's one, except that in all of those mental health concerns, they're divided into different things, right? We have the mood disorders like the depressions of this world. And we have neurodevelopmental disorders like autism, ADHD, and social pragmatic disorders and stuff like that. And then we do have the neurocognitive disorders like the Alzheimer's and the dementias, like they're all in this book. Right? So autism is just one of several.
Okay, so it's part of it. It's not like a separate entity.
Yeah.
Subset.
What I wanted to add to that is this question is very good because it tells us a lot about how people view mental illness or mental health disorders. It's not a crime. It's not a crime, and now, talking about this, I want Doctor, I already know the word, but I want Doctor to tell us what we call people what we call normal people versus someone with, I know people like to use the term normal people, normal versus, people with mental illness or one mental health disorder or the other. So what do we call normal people? That term, is that acceptable? And if it's not, what other term can we use to professionally call someone with a diagnosis or a disorder?
So in my experience, you narrow it down to the disorder in question, right? So, for example, people who have autism, if they don't have autism, it's more recent, but the technical word for it is allistic, ALLISTIC. Right. So there's autistic, there's allistic. That's the word that we use now in our spaces. It's not as popular. If you think about it more along the lines of things like autism and ADHD and things in that area, we refer to those as neurodivergent disorders, right? So like people who are in these spaces are neurodivergent. In that case, the people who don't have those things are neurotypical, right? So those are the areas that I can narrow things down to, but I don't have a name, for example, for people who don't have depression, right? Or who don't have anxiety. And of course, the concept of normal and people with mental health disorder, normal it's a weird word to use because if you say in the cultures that we're from, if you say this person is normal, this person has depression, then you're by extension saying this person has depression is not normal.
Not normal,
right? And what does not normal mean? So if there's a word for it, such as, like I said, neurodivergent to refer to somebody who has autism and neurotypical to refer to somebody who doesn't have autism, I would rather those than normal or not normal. Yeah.
Very, very, very true. Very true. Thank you for that answer. Let's take some comments real quick before we continue with our Basbos. So Levis Creation says, my question is, how do you help out when you see an autistic child whose parents are in denial and claiming it's spiritual?
Well, so when I find the answer to that, I'll let you know.
Well, I believe one of the reasons why he said when he finds the answer to that, he will let you know is because, correct me if I'm wrong, is because this definitely has to do with the parent. You can't really.
There isn't a whole lot you can do about a parent who's saying, I won't take my child to get assessed, or the child has been assessed, but the parent is saying, I won't work with the diagnosis, right? And also, I find that just like many, many people, the more you push, right, the more people rebel. If you're saying, no, your child, it's not spiritual, it's autism, they go even farther out, So one of the things that I try to communicate to people, and a lot of the things that I do on my social media platforms is to make conversations about autism as normal as possible. Right. Because I think for many people, if you think you're the only one who is dealing with that, you're more likely to think it's spiritual because why me? How come I know nobody I know has autism, only me, people in my home. You understand? But if you find out, oh, Dr. Luis actually has 2 kids who have autism. Oh, this person has, this person's child has autism too. So who are these people in your home who are just throwing autism around to people that you don't even know? And the more people realize how common autism is, the more people realize how many kids get diagnosed with autism, especially when they see how the diagnosis and seeking support improves their lives. They are more likely to take a deep breath and know that even if the child has autism, the child is going to be okay. So I'm not big on it's not like you can't push it. There isn't too much you can do except for us to continue what we're doing to make it more of a normal thing, so that it might be as common as a child who has been diagnosed with diabetes type 1 in childhood. Even if you do feel unfair that a child has to deal with diabetes, even if you do feel unfair that a child has to deal with, deafness or, childhood blindness or childhood cancers, even if you do think that it's spiritual, you're still going to take them to the hospital to seek care, right? So I'm not going to fight. I mean, you can't, but I'm not going to keep saying that it's not spiritual. I'm just saying that even if you think it's spiritual, here are some physical things that you can do that would give you a good chance of helping your child.
And I just want to add that some of you that are thinking that yes, it's spiritual, some of your men of God are taking their children to get evaluated and get help. They are also getting the help.
Mhm.
So why withholding, why denying yourself of ways to learn how to effectively function with your child? Why are you denying yourself of ways with that in just because of spirituality and all that? So let's take
Right.
another
And
question.
Max, briefly, as an adult, if you get a really bad headache that you think is spiritual, if you get food poisoning that
Mm,
you think it's spiritual, you're still going to go to the hospital, right? That, hey, doctor, my
yeah.
stomach hurts. Let the doctors do what they need to do to be able to say, if they do say we didn't notice anything, you keep doing what you're doing on the spiritual end, but you still go to the doctor's office to maybe get the physical side looked at. So
Yeah.
even if you think it's spiritual, please go to the psychologist or go to the specialist to look at the physical aspect of it and do what you can from that end while you continue to pray.
Oh yeah, very true, very true. All right, you guys see what I was telling you about. By the way, happy Mother's Day again.
Mm.
If you have not shared, please begin to share. Go to the link where you're watching this from. If you're watching this from YouTube, go and copy the link, send it to at least 5 people that you know. 5 people that you know. That person that you think that needs it, share it to that person. And for those of you that don't know how to comment on YouTube yet, because I know some of you don't know how to comment on YouTube, go and look for it by the side. You will see a comment section there where you just click on and it opens and you just type your comments. Okay. All right. So let's take the next question. Pretty Annie, you want to read this question for us?
Which direction do you go to help the child in question? And I think that's from the previous.
Yeah, that's from the
question.
previous side. Okay. So
Yeah.
Dupe says,
My belief is that prevalence, is that what she said? Prevalence of autism is high here in the US. Yep.
hmm,
Can it be that, question, comma, quotes and unquote, being over prescribed,
hmm,
over diagnosed?
Mm.
Less than an hour ago, a friend, interesting, complained bitterly to me. Oh,
Okay.
his son
oh,
was diagnosed with autism and
and he
he
doesn't
doesn't believe
Huh.
or accept the
The
diagnosis.
diagnosis.
Huh.
That's
Okay.
interesting.
That's actually what we're talking about already.
Yeah,
Yeah.
right. Mhm.
Go ahead, Doc, so that before
So, the point about it being more common here in the United States, I think it really boils down to the fact that the United States is one of the countries with the highest number of, I mean, while it's not great when it comes to one-on-one, but we have a decent number of mental health professionals, and conversations about mental health we're talking about it every day
mm-hmm,
in
mm-hmm.
the US, right? So more people are hearing about things and taking their kids to be diagnosed. If
Yeah.
you do suspect certain things, pediatricians are seeing it and referring you to the psychologist, and it's schools are seeing things and referring you. Like so many people in these points of contact have decent enough information to tell you, I'm seeing this, go talk to a psychologist. I'm seeing this, go talk to a pediatrician, right? And of course, the more people get referred, the earlier we catch these symptoms. So we talked about earlier, if they're doing their work well, then they're not going to overdiagnose as much as diagnose. Like we will catch,
Mhm.
so we'll catch it early and diagnose it and give them the support. So I honestly don't think that it's overdiagnosed as much as we do have the resources and the structure and the support systems to diagnose it here in the US compared to a place like Ghana where I'm from, where I did not set my eyes on a psychologist until I was in college,
Mm-hmm.
right? So at that age, I mean, when I was growing up, there was a child who lived very near to our home who I think autism was in the mix there, but it was more likely some other neurodevelopmental disorders, some other, disorders such as, probably Down syndrome or Fragile X or something that at the time I did not have the name for. I did not have an idea where the child could get help. And their child's parents did not have any idea either.
So sorry, Pretty Annie, I know you had a question to ask, but I just want to talk about this a little bit before we go to your question. So in line of Dupe's question, I kind of felt the same way, or I kind of feel the same way, because so I'm a PMHNP, psychiatric mental health nurse practitioner, and pretty much in the field, I've seen a lot of things, right? But yes, you're kind of right, because back home or in Africa, where we have less diagnosis or less availability for people to be able to be diagnosed, we don't get to see all these things play out, because you're not presenting yourself to be checked. So imagine like a country that has a high prevalence of HIV, but they are not going to get tested. Nobody knows they have HIV because nobody knows that anything like that is happening in that country, because we're not getting tested. But if we go and get tested, then you begin to find out that way too. It's as if this country has a lot of HIV patients. But the truth is, they didn't really have a lot. It's just that there are a lot of testings done,
Exactly.
So my sister once told me that, I always laugh when I think of this, right? She once told me, she said, Mex, you people in America, you people's major problem is mental illness. We in Nigeria, our own major problem is malaria. And I was like, of course, that is what you think it is, because clearly you guys test for malaria like water. Right. Every week you are going to check for malaria, typhoid, malaria and typhoid. But we have those resources where people go to, and whenever they feel a certain way, they go and then they get tested, they get checked.
Like you make a great point, because we're not going to tell people in Ghana, for example, where I'm from, that malaria is being overdiagnosed, right?
Exactly.
You understand? Over there where, when I was growing up, I think I may have had malaria at least once a year, to be honest. Like everywhere you go, we carried mosquito nets with us as much as possible, because these days where there are creams and stuff to rub on your body, like it's always that, because you're preventing malaria, because there's stagnant waters everywhere. Like the things that lead to that is everywhere. We know about it, so it's what's killing us. So we test for it. That's what we prioritize in our system.
Yeah.
When you come to a system where there are more resources to contain malaria, we can afford, in quotes, to then test for things like autism and ADHD and other mental health concerns as well. So no, good point there.
So this is to your point, right? I don't think I also do think that sometimes there are cases or situations where people have been misdiagnosed.
Absolutely.
I've seen it happen, I've seen it played out, and then this child was evaluated and they said the child had autism, but clearly the reason why they said the child had autism got to vanish over a period of time. So what could be the reason why some children will have some things that might show that they have autism? I believe, doctor, correct me if I'm wrong, hand flapping, constant repetitious hand flapping is also part of it. Part of the sign. Now, a child can learn hand flapping from another child with autism in school and come home, and all they are doing is this, and screaming constantly. And you now, as a parent, will be like, oh my God, if I say my picking hair autism. So how do parents actually figure out
if a child has autism?
If a child has autism or not? When you answer, then Pretty Annie can answer a question. Please keep sharing. Go ahead, sir.
Max, give me about 2 minutes. Let's run through the symptoms of autism and the things that we have to actually go through to diagnose a child with autism. And then we can touch on the likelihood of misdiagnosis, right?
Let's go.
To diagnose autism, there are 7 symptoms altogether. The first 3, I typically group them into 2. There's the social issues, and then there's the restricted or rigid behaviors, right? Social issues, 3 of them: difficulties in that, back and forth, free-flowing communication, ability to engage with others, share interests with each other. The next one is difficulties in nonverbal communication, such as difficulties with eye contact, difficulties understanding social cues, such as, like for some of us growing up now, your parents will look at you and do eyes like this, like, come on, move, without using words. And you just understand. Nobody actually taught you. You've seen it so frequently, you just understand it. Individuals with autism will struggle with things like that. And the last one is, in that social aspect, is difficulties developing, maintaining, and understanding relationships. individuals on the spectrum may be able to build a relationship. Oftentimes they struggle building it to begin with, right? But many times they struggle maintaining it because the things that they need to do to the thing that most people do to keep friendships going, such as visiting each other, checking in on each other, and doing things that other people are interested in, even if you're not necessarily interested in. Individuals with autism struggle doing those things. So these three things have to be present in an individual in order to diagnose autism. Now, when they're younger, it's a bit hard to tease apart, but we'll talk about that later. These three need to be present, and then for the other four, two of them need to be present. One of them being those repetitive behaviors such as hand flapping or finger tapping or rocking while on the tippy toes, like all of these different movements that make people go, why is that child doing that? The next one will be difficulties with change. The smallest change that most kids can deal with no huge issues will make this person with autism have a meltdown. And everybody's like, it wasn't even that serious. Why are you this upset over this small change? Right. The other one is restricted interests that are abnormal in intensity. Right. So this child with autism might be into something that maybe quote unquote normal, like kids their age are interested in, but this person just goes so deep, knows so much about it, wants to, everywhere you meet them, conversation somehow comes back to this interest area, and they don't even realize when nobody else is interested. They will talk about it and talk about it and talk about it. And the last one is sensory issues. It can be hypersensitivity, which is small, let's use sound, for example. You turn on the vacuum that most kids will just maybe step away for a little bit. A kid with autism is throwing a tantrum, like the sound of a microwave. It's not necessarily loud, but it's particular, and it's giving the child a meltdown. Sometimes other people are also hyposensitive, such as with things like pain. They will, get injured, and the same injury that would make other kids their age cry their heads off, it's like they didn't even realize that they've been injured, right? They're undersensitive to pain. So out of these four, two have to be present, right? So 5 symptoms at least have to be present, and then they have to be present in more than one setting. If it only happens at school, but when they come home, you're like, oh no, I don't see this at all. It's not a problem in my house. They don't have autism, because autism is not something you can just turn off because you got home. Right? Or it's not something you can just turn off when you get to school. The intensity will differ, right? Because when they're home where they're safe, they're going to likely be more expressive and give you their all. But when they go to school, maybe they tone it down a little bit, but they don't turn it off.
Yeah.
Because they can't, so you're seeing it at home, you're seeing it at school, you're seeing it in the church, you're seeing it out and about when you're around. So it has to be present in these other areas. And then lastly, it has to cause significant impairment, as in it has to be affecting things. So if your child has some quote unquote quirks and it doesn't affect anything, a little hand flapping here and there, it's no issue at school, it's no issue at home, it's even funny, you people think it's funny, you laugh at it, and there are no other concerns, the child doesn't get diagnosed with autism, right? And then the last other thing, which is in, more of a things like that, the concerns are not better explained by something else, right? So if a child lives in a traumatic environment, for example, where because they're being abused, they tend to be more quiet. They've made themselves small, because anytime I speak now, my father will slap me. So when I'm anywhere, I'm quiet. I don't want to engage with other people. Then that person's social issues are more likely due to trauma and not because they have autism, right? Yeah. So a person who knows what they're doing, if they go through all of these steps, the chances of them misdiagnosing someone with autism gets lower and lower the more you go down these steps, right? Because you have to see all of these things, see them in more than one place, be able to say it's not due to something else, or before you say, yes, this person has autism.
You see something you mentioned that annoys me all the time. You see that school? See that school you mentioned? Those people have made children to be misdiagnosed a lot. I'll tell you why. Some of the teachers in school, obviously you have to take some information down in school, take information at home, 2 places to be able to verify a diagnosis. But some of those teachers in school, they feel like they are professionals at diagnosing these things, and even without an official diagnosis or anything, they will call the parent and tell the parent, I think your child has autism. And you will say, why? They will say, oh, because they were flapping their hands in class, or, oh, I think your child has oppositional defiant disorder, because it's not sitting down in one place. For crying out loud, you have a little child that all they want to do is run and play, and you want them to sit down in one place and just. So all these things, we'll go deeper into it. But first of all, let me welcome my big brother who was in traffic and just came back.
How you take Joseph?
Huh?
How you take note? I want to talk.
I know now. I know you now. I know now. Welcome.
Third Million Bridge traffic.
Yeah, welcome to the show, sir. Welcome.
Thank you.
Yes.
It's
So
good topic.
yeah. So we've been talking about autism and how to care for children with autism.
Mhm.
And obviously today is Mother's Day. We
Happy Mother's Day
to all the
to
mothers and
all
the
the
potential
mothers.
mothers.
Yeah, this one is a potential one.
Happy Mother's Day. Yeah, she look at us.
Exactly.
So let's quickly take some more questions. But before we read everybody's questions, I see my senior colleague in the house, Annette. Welcome to the show.
Welcome, Annette.
Yes, I call her my senior colleague because she's my senior colleague. Welcome. So please, before we take the next question, please let's keep sharing. The numbers are going down. I can see it's going down. Let's keep sharing. This is very, very informative.
Bring it up.
This
everybody.
is very educational.
Yes, it's very.
This is something that you would learn and be able to figure things out on how to get help. Okay. Doctor, you wanted to say something?
Right. Now I wanted to touch briefly on the school system and the tendency to, in our field, we say over pathologize, right?
Yes.
Like the school system is overwhelmed. So there's an expectation for kids to be just right. So any kid who is a little bit more hyperactive, sometimes like, oh, this kid, get him on medication so we can, contain them. I get that. Right. I get that. But you have to keep in mind, like I said, that they will check when we're assessing, we'll check how they're doing in school. We'll check how they're doing at home. Well, if you're doing it right, like in my case, I give them people at home and people at school a very detailed form. It's a huge, long form. Right. So unless we're saying that the teachers are going out of their way to lie and say they're seeing certain things that they're not in fact seeing, right, the chances of, it actually leading to a misdiagnosis get lower and lower depending on the person doing the testing.
Yeah.
Right. Because if you just have them, do a 5-question questionnaire, stuff like that, it's more likely going to be skewed. But we go into a lot more detail, especially when you're thinking about things like autism and ADHD and stuff like that.
Because a mother once told me that her child, they didn't even talk to her officially about it. What they just did was they called her and told her, oh, they are recommending her child to be in a special class. Now, that's even different from another story that I've heard. So I get to hear all these stories because I have patients, and we talk when we're talking about their own situations, they tell me about other things too. And I get to hear all these things. And when I hear all these things, it's kind of painful, because these things will come up. And then your child, you end up realizing that, oh, this is actually a learned behavior that your child will kind of learn from another child who is sitting next to him, because children love to mimic things. They love to do what other children are doing. I remember when I was little, I would watch a cartoon and then I would begin to walk like Robocop. Somebody would ask me now and say, oh, this, because I'm doing that, So I guess this will segue into Pretty Annie's question.
Oh, yeah. So my next question, I wanted to figure out if autism is inherited.
Yes, so autism, like ADHD, has a strong genetic link. I don't have the exact number for you, and I can find it out as we continue to talk. I'll look at it and let you know. But yes, there's a strong genetic link. Typically, if there is an immediate biological relative, such as a parent or a sibling that has it, there's a decent chance that somebody else in the family has it or will have it. But then, just like any other inherited trait, it's not 100%. Right? It's not even in the 90s or anything like that. But there is a strong genetic link. So, I guess that's a short answer to the question. But it's important also to keep in mind that it doesn't necessarily mean that if you have it, then somebody has to have it in your family. Right? I don't know if that makes sense.
You already answered that. I was gonna say, does it skip generation?
So there are times when nobody in the family has had it before, and somebody gets it in this generation. We can go another 2-3 generations before somebody else has it, gets it. So how when they do all of these statistics, it's based off of a collective. Like years and years of research, as opposed to, so there might be some families that it doesn't skip a generation, multiple siblings have it in the same generation. There'll be some families that don't have it for several generations. And when all of that research comes together, we find the numbers of heritability. But yeah, that's the extent of it. Yeah.
So, on that, when you, does it mean that lifestyle can lead to somebody having a child with that kind of condition? Lifestyle, and when I mean lifestyle, like people that abuse drug abuse, and substance abuse, things that affect your body,
But
will and what you eat and how you live your life. Does it affect, lead to that?
so
Lead to that?
I know ADHD for sure, but since autism has been linked to things like lead, lead poisoning and stuff like that, but I have not seen studies on drug use necessarily, especially specifically to autism, right? So keep in mind. So for example, drug use can lead to intellectual difficulties, right? So somebody, due to a family parents using drugs while pregnant with them, can have a child who's born with intellectual disability or intellectual difficulties. And a child who has intellectual difficulties will struggle with their social skills. And sometimes that looks like a child with autism because they don't have sometimes the intellect to engage and do things socially in a way that's appropriate. Right. So then in this case, it's like it's more so we do have a diagnosis such as autism with accompanying intellectual disability, or autism due to or with associated Down syndrome, or with associated Fragile X syndrome. So sometimes some of those things such as drug use and some of those things do affect the other disorder that then kind of ties into the autism and makes it maybe more severe than it otherwise would.
Okay.
Right. But the research out there isn't yet specific on a particular lifestyle change that will prevent autism. One thing that I've seen several studies on is like with metals and things such as lead poisoning in the parent.
Okay, thank you very much.
Thank you. Thank you.
Ladies and gentlemen, you guys can see how educational this is going. Okay, so let's take 5 seconds break, and then we will come back. Let's calm our brain down. Let's calm down.
Hi, so glad you are here with us today in Chat Room with Mex. I am Kay, and I hope you are having fun. Please subscribe, like, and lastly share. We need to let the world know what we are enjoying here today in the chat room. Now let's go back to the show.
All right, so welcome back to Chat Room. As you can see, we're having so much fun learning. My boy would say, it's so much fun.
It's so much fun.
So let's take some questions from the audience, people watching, and then we'll continue to fire down, okay? Okay, so yes, we have tons of questions, a lot of questions. So let's go. Where were we? Yeah, we think we're starting from Healthy Jesse Chops. Yeah, so go ahead, you can read.
All right. Does autism look like children who behave like they're not normal? Because sometimes in Nigeria, some children were acting like snakes taken back to the river.
Okay.
Jesse
Chops.
Interesting girl.
It was such a loaded question.
It's not a loaded question.
Not going to kick at it. Okay.
Yeah, so I believe she's trying to ask what autism physically looks like.
And I think we already.
And we've talked about that already. We've talked about the signs, the hand flapping, repetitious behaviors, things like that. So let's move to the next question.
Well, Max, real quick, let me say one thing. So we've talked about the behavioral things, but autism has a physical look. Not like things like Down syndrome, where if you know what you look, you see the person's face and how far out certain features are out from each other. So Down syndrome, for example, has a physical look. You can, if you're trained, you can see Down syndrome on a person's face. Autism doesn't have that. So you can look at somebody's face and say that the person has autism. It's more behavior, it's the behaviors that you're going to use to learn. So hopefully that helps this person when it comes to.
I think so. Yeah. Okay, next question from Dupe.
To him, the young boy is social. His growth rate, he said, is normal. He was accepted to go into a normal school as against IEL. Not very sure if that's the term. I think that's probably
okay. So that's with
from
regards to
previous-
the previous question she asked about her friend's son who was diagnosed with autism, but the friend is refusing that diagnosis. So to the friend, the young boy is social. His growth rate, his growth rate is normal. He was accepted to go into a normal school, I guess, against the IEL. So pretty much from this information, what do you think? I guess that's what she's asking.
Right. Well, so like we said earlier, autism is primarily it's first and foremost a social difficulty issue. So if the young, the kid does not have any social difficulties, the kid engages appropriately with their peers and with others, with adults at home, at school, no issues, then autism is not likely. However, I am sitting on YouTube somewhere having this conversation, right? If the person who actually sat with a child, engaged with the family, had parents and the teachers fill forms, says the person has autism, it's more likely than what I think, And I think people forget that you can always get a second opinion from a professional.
Oh, yeah.
Right. So if this person diagnosed your child with autism and you don't think it's accurate, you can get a different professional that you probably are more likely to trust. Right. Like we live in the US, so there are so many things that are probably more common in our communities that certain professionals who are not as culturally sensitive might misinterpret as a repetitive behavior or a restricted interest, or that this child is not social.
Isolation, yeah.
Exactly. Like some of us grew up in an environment where a child is supposed to be seen and not heard. Right. So if such a child goes to school and they're often in their own corner until asking a question, right? This teacher is probably thinking, why is this child always in their own corner and not engaging and not asking?
Or why is this child not looking at me in my eyes?
Exactly. Now good luck going to talk to your Nigerian father, looking at him in his eye.
Yes.
So if a child like that goes to school, maybe they are not going to be looking at the teacher in the eye. So if those are some of the things that led to the diagnosis, then you're able to say, oh no, that is very, very normal in our culture.
Exactly.
But also, like, these people, when they do diagnose things, they should be meeting with you to make sure you're on the same page, to make sure you understand things, to make sure they answer your questions, right?
Like I said earlier on, they don't. Majority don't. They don't have the time.
And then talk to you a bit about why and how they came to the diagnosis. So if they have not had time with you to answer that, I would recommend that you meet with them, have them take you through how they came to the diagnosis, so that you can say, oh no, this is actually very normal in our culture. And if you effectively, and this is with you being 100% honest, like you're not going to lie about a symptom that really isn't normal and say it's normal, right? But if you're honestly saying, oh, this is very normal in our culture, that's how all the kids in our spaces do, and that's why you see it that way. Or this, he copied it from his brother, or this, he did this here. Like, if you're able to then effectively, quote unquote, punch holes in all of the things that led to the diagnosis, then the person resets and takes a second look and say, okay, right, if this is normal and this is normal and this is normal, then they don't have autism.
Doctor,
go ahead.
What about that child that is being abused and you're having a parental abused environment?
Right.
Can abuse lead to them misdiagnosing the child? Because sometimes it's a child that is being abused, they are isolated.
100%.
So as a result of that, you might the person that is doing the testing, they might miss it. So they have to be able to differentiate an abused child.
Abuse and trauma is actually one of the most common causes of misdiagnosis of things like ADHD. Right? Not as much autism, but things like ADHD. Because ADHD, because it's often around, things like attention and hyperactivity and impulsivity. If the person's living in a home where they are getting slaps left and right, when they come to school, especially when it's getting close to time to go home, their mind is already going, oh man,
remember the slap.
Time to slap.
Right, exactly. So for that last period before they go home, they can't pay attention. So that teacher will fill a form that says this child can't pay attention.
Mm.
You understand? When in fact, it's because the child's mind is on the slaps that he'll be receiving when he goes home.
Mhm. I'm sorry to say this, but I think, like I was telling a colleague at work, I think we should have more Africans go into this field, because no offense to any Western, practitioner or Western professional. We that are from back home, we know how life is back home.
Correct.
We know that at some certain time, this is supposed to happen, that is supposed to happen. At a certain time, you might grow up with parents that, trained you not to go out, trained you to always be in the house, trained you, hey, don't look at me straight in my eyes. Right. You have to respect your elders by looking down. You have to talk soft.
Right.
You have to, when you are in a place, you have to sit like this. That's a respectable way to sit down.
This military regime has really affected Africa.
But when we now come over, we see our children going to schools, and because parents were trained to live a certain way, they are living a certain way, and by mode of learning, the child learns that behavior from the parents.
Right.
It continues.
Exactly. And it continues. Now you go to school, your teacher is talking to you and you're looking down. And then they either think you're lying or they think you have ADHD or something else because you're not looking at them in the eye. So I think it will be good to have more practitioners that come from, that have that training back home to be able to understand these particular things.
Very good point.
So that's my 2 cents. So we have a lot of questions coming in. I just want us to take a lot of them. Livy's Kitchen says,
I also agree with you, doctor, that creating more awareness is very important, not just for autism, but for other mental health disorders as well.
Yep. Annette, my senior colleague, says,
autism is a spectrum of illness. There is a varied degree of the manifestations with mild to severe symptoms. Challenging.
Very, very challenging. Dupe says,
please explain autism in savant.
Okay.
So I don't know nearly as much about savant syndrome, so I cannot go there. I know for sure, though, that they are two separate things, right? And I don't know nearly as much as savant to then be able to tell you the difference.
Yeah. So we're gonna have Dr. back on the show because we're gonna be talking about ADHD also.
Now, that's my jam. That's really my jam.
There you go. So we're talking about ADHD also, and then we will now come back again and correlate both of them together and let you know both of them separately. So let's keep going with the comments. Mr. Eugene is in the house. He says,
hi, chat room with Max. We're watching from Jos, Nigeria. I wish you a happy Sunday and a fruitful week.
Yep.
And happy Mother's Day to mom.
No, Nigeria Mother's Day is not today.
Oh, that's true.
Their Mother's Day is not
so we are
today.
sending them our own too.
No, but they always wish people over here happy Mother's Day.
No, wait, we can't be doing. How many mothers are we doing?
I don't understand.
You want my mother to come here and say, "Where's my Mother's Day?" You stop it now. I know do Mother's Day twice.
You are equal to the tax.
Now, Max, do you mind? Let the viewers know that I do have. So I'm on YouTube as well, so they can follow my YouTube channel as well as my TikTok page. I have several videos already about some of these things.
Oh God, yes. In fact, if you go to his TikTok page, that's where I found him. I was thinking
you will be informed.
Not just informed.
You will not be deformed.
Don't turn this one to church now.
You will be informed.
Okay. You will not be deformed.
But you will be transformed.
Yes. So he's on TikTok, he's on YouTube, he's on Instagram. He has great content. In fact, he talks about all this diagnosis to the fullest. When I was watching him, I told my sister, what's her name again? Oh my God.
Is it Alice?
Alice. I told Alice. Why did you shake?
No.
It's cold.
Okay. I told Alice, I was like, we need him on this show. We need him on this show because he's very, very knowledgeable, as you guys can hear. He's
Alice, she's good.
he's very, very knowledgeable. So please and please, sir, can you tell us your Instagram, your TikTok handle, YouTube handle, and
All the
all
handles.
your handles,
Oh, yeah,
even your cup handle?
I'm actually trying to join the chat and see if I can connect. But the let's see here. The handle that I use this everywhere is your neighborhood psych, right? So if you search with that, you can actually find me anywhere. So this
Your neighborhood psych.
YOURNEIGHBOUR. Let's see. We don't use the U here in the US, so it's that. I just shared it in the chat at the bottom.
Yeah, so it's on the chart right there, right here. Your neighborhood
Psych.
Go on every platform and type your neighborhood psych.
Follow him.
And
Follow him.
I should pop up everywhere.
Share his content. His content really. You guys need to watch. You guys need to watch what this guy is doing on social media. He's very, very, very talented, very, very impactful on social media. You will know that this is what he does for a living. Me, I'm a PMH NPO, a psych mental health nurse practitioner, and I know that I cannot touch on this topic like he is because that's not my specific specialty. But this is his bread and butter. Okay, so your neighborhood psych, everybody. Your neighborhood psych. Have you followed? Okay, good. I've followed already, definitely. Yes. So let's keep going with the question. I'll definitely share the handle again for everybody to get it. Eugene says,
can autistic child speak normally as it develops with age?
Yes, yes. So I guess another quick thing which I have a full video on. So whenever we talk about, we look into autism, like I said, so we're looking at the social issues and then the rigid behaviors. So not every child with autism has language issues, and not every child with autism has intellectual issues, right? So there are so many people who we would assess and say this person has autism with no accompanying language or intellectual impairment. Many children with autism do have language issues, but it's not everyone that does. So yes, many children do speak with no issues at all. Many children do, have autism, but have no intellectual issues at all.
Yeah. So piggybacking on this question, is there such thing as high functioning autism?
Yeah, actually, I think it's more to think about it as, if I say there's not, I will still then describe somebody who has autism and functions really well, right? So it's just a case of what you call it. Certain people refer to high functioning autism to speak to people who, for the most part, function on their own, do not need as much support, or you may not even be able to tell that they have autism. And that's the thing, right? Because when we diagnose autism, there are levels to it. There's level 1, level 2, level 3. Level 1 being, that they require support. Level 2 being they require substantial support. Level 3 being they require very substantial support. And then we go to the point where we say they have intellectual impairment or they do not have intellectual impairment. Then we say they have language impairment or they don't have language impairment. So kind of think about somebody who has level 1, which is requires support, and has no intellectual issues and has no language issues, right? That person is more likely to, function better, in quotes, than the person who has level 3, which is requiring substantial support and has intellectual impairment and also has language issues. Right. So for this level 1 person, I guess technically they are higher functioning than the other level 3 with those other impairments. So that's the way I think about it.
Okay, nice. Thank you. Tupa says,
I have shared this chart with my friend. Hopefully, you'll gain better insight.
Thank you very much. Thank you for sharing. Yes, definitely. And tell him to go to your neighborhood psych. Your neighborhood psych. He can ask Dr. Lewis any question he wants, and Dr. Lewis will help him out. Okay. In fact, he can consult with Dr. Lewis too. Livy's Kitchen says,
if you're in Nigeria watching this and you are convinced now that you need to get your child checked, please get a professional help and seek medical help from a reliable source.
Yep. And of course, you can always send your questions to us. We will forward them to Dr. Lewis. You can hit up Dr. Lewis and he will answer your questions. Livy's Kitchen furthermore says,
just saw a doctor got arrested for being fake and not even a nurse. Talk less of being a doctor. after 3 years of practicing and doing surgery.
Yeah, that's a different ball game.
No, she's trying to say that they should be careful who they go for. The diagnosis. Yeah.
Well, definitely. So, my question, Dr. Lewis, is where can people get help? People that need help, where can they find? What resources can they use to be able to get this help?
So I am not nearly as familiar with resources in our home countries, like as resources in Ghana or resources in Nigeria. But I always tell people your best starting point is your primary care physician, like your doctor, right? So your child's pediatrician, or your own, primary care physician, to then start the conversation, because they should know better about the next steps. And if they don't know at the time you ask them, they should be able to find it out. Right. So I mean, I can't sit here and say, in Ghana, for example, if you go here and here and here, they'll help you, or in Nigeria, because I mean, even if you think about Nigeria and how big Nigeria is, it may be available to somebody in Lagos, it won't be available to somebody in Ibadan. You understand? So it's important to talk to your immediate professional first, so your doctor or your child's pediatrician, and then have them guide you through the next steps. Yeah.
Wow. So can my last question, I don't know if any of you have questions, but my last question for Dr. Lewis from my end is is it possible that someone with autism can go undiagnosed till adulthood?
Several people go undiagnosed their whole lives.
There you go.
Several people go undiagnosed their whole lives. Like they live and die and nobody knows they have autism.
So I have autism right now. I'm just kidding.
That's true. Cameraman, zoom in. let's assess.
So many of especially when you think about what many people refer to as mild symptoms, right? So many of the behaviors in people with autism, especially those that don't have any intellectual issues or language issues, often referred to as high functioning, many of those behaviors we explain away, like, oh, so this child is just shy, or so for a child who tends to isolate and be in their own corner and not engage with other kids, they describe that child as shy. and sometimes they are, sometimes they're not, right? So they are shy at home, they are shy at school, and some of them we describe them as quirky. So some of the behaviors, it can be hand flapping, it can be finger tapping, or it can be certain things that they do, you name it. But if we are saying they are shy, and sometimes because they're shy and they're always in their own corner, we're not even seeing the said behaviors to begin with, right? Or when we see them, we say they are quirky. If they tend to be rigid and not good with change, we say they have OCD, or they are stubborn, or they don't do well with change. Again, we explain that away as well. So if we're finding ways to explain all of the symptoms away because we're not seeing them really suffer, then we're going to miss it. So usually that's how many people go their whole lives without being diagnosed with autism, because their symptoms are explained away. I cannot hear you, Max, if you're speaking. Uh-oh. So from my end, you are frozen. Actually, if there's anybody who can hear me, just let us know if you can hear Max.
Your neighborhood.
All right.
Your neighborhood.
Oh, where is he?
Uh-oh. Okay, so
Okay. Let's try again. Can you, Max, can you hear me?
yes, I can hear you. Can you hear me?
Okay, we're back now. Yes, I can hear you.
Sorry about that. Network issues. Had to switch devices immediately. Yes. So, yes. Thank you very much. Thank you very much for that. So we would want you to come back and talk about ADHD.
Right.
We would want to do ADHD. When can we do ADHD, guys? Should we do ADHD like 2 weeks from now so people can get to have their questions ready and everything?
I would have to check.
Oh yeah, Dr. Lewis.
So I would have to check my schedule, check my wife's schedule to see what we can make work. So Max, let's talk on the side.
Oh, yeah.
Let's talk behind the scenes and then nail something down for when we meet to do that.
Yeah, definitely. We would definitely let's do that. That would be good. So ladies and gentlemen, we want to thank you very much, Dr. Lewis, for coming on the show. Thank you very, very much. We appreciate you. Let's take this last comment before we go. Livy's Kitchen says, just saw a doctor got okay. We read this comment already. So yes, please, ladies and gentlemen, follow Dr. Lewis on YouTube. You can follow him on every social media platform. Your neighborhood psych. Your neighborhood psych on every social media platform. Okay, so thank you very much once again, Doc. We really do appreciate you
Thank
for
you,
coming
Doc.
on the show. Yes. So just
My pleasure. My pleasure. Nice to meet you both.
yeah.
Yes.
All righty. We'll touch base and then we'll talk about the next ADHD talk. That one is very, very interesting because we have different types of ADHD, the inattentive type,
and the type impulsive.
Yeah, you will be able to figure out why your boyfriend loses his keys or your girlfriend loses her keys and can never ever seem to stop. Don't worry, we'll talk about it.
They will start diagnose their boyfriends.
Yeah, you can diagnose your boyfriend and girlfriends. Well, thank you very much, Doctor. We really do appreciate it.
I had fun. We'll talk to you soon.
Yes, sir. All righty. All right, guys. It was fun today. Thank you very, very much for being on the show. We do appreciate you for sharing, for the love. And don't forget, you can still continue to share this particular show because you can always go back and watch it. You can always go back and watch it. Dupa, thank you for your questions. Your questions were very, very, insightful. Thank you. She says Stephen Wickshire is described as autistic savant. That means they are high functioning autistic people, right? Well, we talked about that already, and we talked about the levels from 1, I think it was from 1 to 4.
Some of them are extremely smart too.
Yeah. So definitely, please save your questions for Dr. Lewis when he comes back to talk about ADHD, and we shall see you. We're not going to do the show next week because we have we might be doing something else next week.
Yes,
but
stand by.
Samsoft says stand by.
Stand by.
Where this thing can go? Okay, yeah. So we shall see you all in 2 weeks. Okay. Thank you very, very much. It was nice having you on the show. And keep sharing, okay? Keep sharing the love.
Sure.
Yes. Take care. It's your boy, Matt. I want to introduce a show to you. It's called Chat Room with Max.